A pandemic is when a lot of people get sick with a new virus or infection. Right now, the coronavirus pandemic is a brand new virus to humans, and it is affecting a lot of us. Some of us subclinically, meaning you don't really have symptoms, but you are passing it along, and others a lot worse, with pneumonia requiring hospitalization. One of the things that we're learning about coronavirus being easily spread, not only is it going to be a droplet spread, so it's going to be out about 3 to 6 feet around you, but it's also being found on surfaces, and it can live on surfaces for hours up until days. How is it spread? Well, most of the time, if you're ill, and some of the symptoms, including cough, congestion, sneezing, makes these droplets. These droplets go out as far as 6 feet away. It can then infect a patient or affect a patient by landing on a mucous membrane, your eyes, your mouth, your on your hands, and then you're eating, and you can have that infection. Elderly people are more at risk, especially the ones that are over 80 years old, because they have chronic medical conditions such as diabetes, breathing problems like asthma or COPD, certain cancers. So with that, the elderly would have fewer resources physically to be able to mount a good response from the virus and clear it as the younger people can do. Your best treatment is to stay home. Isolating yourself from other vulnerable people is very important. Frequent hand washing if you're out. Social distancing of approximately 6 feet away can help limit the spread of the virus from an ill person to a person who has not caught the virus. Treatment options: stay hydrated. Acetaminophen, ibuprofen, or other cold relievers can be very helpful. But always contact your doctor before starting something. At HonorHealth, we are ready to treat patients with the coronavirus. As you know, we do have the UV light germ zapping robots at all of our campuses, prepared to take on the task of taking care of patients with coronavirus and keeping them safe. Well, listen to the authorities. Listen to the recommendations coming from our president, our governor, and the mayors of our cities. It's important at this time of social distancing, restaurant closures, banning large gatherings of people, to be taken seriously, so that if someone in that group has coronavirus, we can really limit the spread to the other members of the group. So we all really do have a role to play here. If you feel like you've come in contact with someone with coronavirus, monitor your symptoms. If you're feeling ill with a fever, cough, shortness of breath, body aches, please call your doctor for further medical assistance. One of the questions, if your employer wants a test to make sure you're clear before coming back to work, that is something that we're not doing because of testing availability. Things may change in the future, and certainly patients who have been affected or infected by the coronavirus, they're going to have specific instructions prior to going back to work, whether it's going to be an evaluation with their physician. And a lot of these recommendations are going to change over time as we know more about the virus. At HonorHealth, we are taking the coronavirus pandemic very seriously. We encourage you to stay calm, follow the instructions that the authorities are giving to you for social distancing, as well as good hand hygiene. And together we will all play a very valuable role in stopping this spread.